Hello and welcome again to Gambling Harm Awareness Week 2022. For those of you who don't know me, I'm Shane Lucas, and as CEO of the Victorian Responsible Gambling Foundation, I am your host for today's event. Let me firstly acknowledge the traditional owners and custodians of the land here in Naarm from which I'm coming to you today. I particularly acknowledge the Wurundjeri people of the CLELLAND Nation and pay my respect to elders past, elders present and elders emerging, and to any First Nations people who've joined us here today. I also acknowledge that sovereignty over these lands has never been ceded. The Foundation strongly supports the Uluru Statement from the Heart to achieve justice, recognition and respect for First Nations people. During this year's Gambling Harm Awareness Week, we've been focusing on the link between gambling and well-being. Financial loss is a commonly recognised consequence of gambling, but there's less awareness in our community of other forms and types of harm caused by gambling. Gambling can adversely impact people's physical and mental well-being, but even those experiencing gambling harm don't always make that connection. Often it's a question or a comment made by someone else that prompts people to reflect on the role gambling plays in their life, including how they feel and how they behave. Today it'll be our privilege to learn from an inspiring young man about his experiences recovering from gambling harm and co-occurring mental health issues. Following this discussion, I look forward to hearing the thoughts of a panel of medical and allied health practitioners who will offer their reflections on improving pathways to support services. So let me firstly introduce my friend and colleague Fred Rubinstein, a member of the Foundation's Lived Experience Advisory Committee. As Fred always likes to tell us, he's the youngest member of that group. Fred will chat today with Zana Bytheway, one of our board directors, about his personal story. Before I hand over to Zana, let me tell you a little bit more about Fred. I have so much respect and affection for Fred. He's a reflective and thoughtful and genuinely giving person. Fred was only a teenager when his father died. He received a large inheritance, and having grown up watching his dad bet on the races, Fred used his inheritance to gamble. At the same time, Fred struggled with mental health issues and became obsessed with winning. But as he will tell you, he didn't win. Instead, he lost his money and he lost his way for a time, until professional support helped him to find a new path and a new peace with himself and his true inheritance from his late father, his identity. I'll let Fred tell you more as he chats with Zana.
Hello, I'm Zana Bytheway and I'm on the board of the Victorian Responsible Gambling Foundation. Today I'm speaking with Fred Rubinstein to gain an understanding of his experience of gambling addiction and at the same time mental health issues, and to gain some understanding of his journey to recovery. So let me introduce Fred. Fred is a member of the Foundation's Lived Experience Advisory Committee, which provides perspectives from the personal experience of gambling harm to better inform the work of the Foundation. So this is an opportune time to explain the issue of co-occurrence of gambling harm and mental ill health. It is of interest to note that 3/4 of people seeking treatment for gambling issues also experience mental ill health. At the same time, only 22% seek assistance. Stigma and shame often prevent them from seeking support. Fred, thank you so much for joining me, and I'll start by congratulating you because it's now been over 5 years since you've stopped with your gambling.
Thank you, Zana. Yes, it's been a long time. It feels like an eternity ago, but also in the same vein, I can remember it like it was yesterday.
When did gambling start to take over?
When I finished VCE in 2014, it really took over my life towards the end of 2014 and especially the course of 2015. And not having the structure in my life, having a big inheritance and seeking that stimulation, and my personality being someone who wants to win with a big bravado and ego and, you know, look at me and all this money I have and look what I'm doing, I'm the cool guy. All of those things, as you were saying, it was a perfect storm. And subconsciously, I think when I was gambling, it was a connection to Dad because, you know, that was what he did when he was younger, and it was kind of like I was following in his footsteps, but it became in a really ugly, self-destructive way, and that really hurt me.
So what made you continue? What makes you keep going despite the losses that you're encountering?
A lot of it was the bravado and not being able to accept that I wasn't going to have success in this pathway of gambling. And the other one was just, I knew that if I stopped and I looked at myself in the mirror and looked at everything I'd done that was in the recent past, I knew that the work was going to be bloody hard to get myself to where I needed to be, and I wasn't ready. I wasn't ready to accept that I wasn't going to be a winner, that I was, you know, not having success in gambling, and I wasn't ready to do that hard work that I knew that I had to, because I wasn't mature enough, I didn't understand myself well enough, and it really did take a toll on my mental health. You know, I became very depressed. I was asleep all day and awake all night. I was like a possum. It was very unhealthy.
Did you realise at that point in time, hang on a minute, I'm experiencing some mental health issues here?
I didn't. I think at the time in 2015 that vernacular wasn't as common as it's become now. I think also I had never experienced mental health, or I didn't know what that was as much. It's not something that I was taught in school as much as this is what mental health issues look like. These are the signs to look out for. So I just thought I was having a rough go of it and I was just struggling a little bit. But in hindsight, looking back on reflection, I was very unwell and I had some very unhealthy routines for both my physical and mental health. And it just spiraled and spiraled and spiraled until I was able to get support and stick through the process and the journey of recovery.
So what was that like to actually open up to a professional who could probably offer a different sort of support for you?
It was very hard. It was very hard because I felt this person is analysing me, he's judging me, and my first impression, my first idea going in there is, let's trick the therapist. I'm just here to appease mum. I'm just here because, you know, I've stolen from her and I need to do this to get her off my back. And I'm lucky that the guy was so competent and so high level in what he is doing. He was willing to wait and he could see right through me. And over time, I built that trust and that rapport with him, knowing that he's there for me, he's actually there to help me. And, you know, he's not there just to judge me for the sake of judging me, he's there to support me. It wasn't until I could fully understand myself and then with time learn how to manage myself and self-regulate, that I could fully move on from all the damage that I'd done, because it was still kind of lingering. And it was not an easy journey, and it was not a linear journey that you just go in there and everything's hunky-dory and it just flies up. It was up and down, and it was very brutal and it was hard, but it was the best thing that I've ever done in my life.
So what role did your family have in this road to recovery? I suppose it was a particularly challenging time for them as well.
It was very hard because they're not silly. They could see that I was struggling. They could see that when I'm sleeping all day and I'm out all night, that something's going on here. You know, something's not right. And I was, you know, in a sense, dishonoring the family. I was incredibly lucky that my mum stood by me and insisted on professional support and could see through her own professional experiences that I was struggling, but also had the wisdom to know that her alone, she couldn't be everything that I needed.
Yes.
She needed that additional, external, objective, professional support, and she was amazing.
So what were the key elements, do you think, that the psychiatrist was able to, you know, extract during the time that you had with the psychiatrist?
I think the key elements, I suppose, were his personality, his patience, but also his wittiness, you know, building that rapport and realising that he wasn't just some person that I was just going to go talk rubbish to and he was just going to accept it and then off we went. He was just waiting until I had that trust and respect for him to be able to share with him what was going on in my life. And that was complicated because I wasn't honest with myself. I was lying to myself. You know, I was very unwell at the time, so it was hard to look clearly on what I'd done, what I'd lost, the impact on the relationships. My mindset was so distorted by gambler's logic and it was my overall health and state of being was consumed by gambling and the problems from that. I couldn't see the picture clearly.
More people are willing to admit that they've got mental health or alcohol or drug issues than they are prepared to admit that they have a gambling harm issue. Why is that, do you think?
You can't see with your eyes always the adverse effects and the problems that arise from gambling. You can see an alcoholic on the street and the problem that causes. You can see a drug addict on the street and the effects and the problems that causes. But you can't see just looking at someone in the pokies, you know, with their shoulders hunched. You don't know what's going on in their mind, in their life. So it's not visible. And because of that, you don't feel it as much. It's not as bothersome to the general society. It may be, and probably is, to that person and to the people closest to them, their friends and family. But to an everyday Joe Blow, they're just like, oh, it's just, you know, someone just going about their business. It's none of my business, and I'm just going to leave them to it. It's not bothering me. You know, that's their business.
Do you think the stigma associated with gambling harm as opposed to mental health was more pronounced?
I think it was. I think because it's seen, and it is, as a choice to gamble. I think also because there's still a misconception that you can win in gambling.
And success.
Yeah, because even if you win, you lose. It's a big price to pay. Because I say this every time I speak, and I think it's such an important point. When I was in that, when I was consumed by that, I wasn't just gambling money. I was gambling with my life. I was gambling with my livelihood. It was becoming very dangerous. It was very bad for my health. It was very bad for my relationships. So I was gambling with a lot more than money. It was taking a toll on my whole life.
Do you think it would have been possible for you to quit gambling if you hadn't sought assistance?
No, I don't. Because I didn't have that information about myself to make an informed decision. When I was in school, there's drug ed, alcohol ed, sex ed, but there was no gambling ed. And when I was in that, I was still consumed by that bravado and that idea that I was smarter than this guy or that system, that I could beat that. But it wasn't until I got that support and got that information about myself and the tools to manage myself. I didn't know any better. I don't think I was happy, truly happy ever at any point gambling. But I don't think I could have gotten to where I am now without support, without professional support. I think it was, for me, in my journey, impossible.
Fred, what do you think a gambling harm screening tool will do to assist people that have had your experience or are having your experience and are at the very early stages of recovery?
I think it's a really good form of feedback, the sort of feedback that I needed, that I didn't want to hear, but that I knew that I needed, is that I can give some information and get some information back, and just some objective, clear information, because of course the family, they love you, they want to help you, but sometimes you need to step out of that emotional sphere and see the bigger picture. And I think the screening tool can do that in an objective, clean way, without bias, being completely impartial. And I think it's a way of supporting.
Fred, thank you so much for your time and being so honest and sharing your story, the ups and the downs and the ultimate success. To finish up, just a reminder that if you or anyone that you know is experiencing gambling harm, that help is available. The Gamblers Helpline is available 24 hours a day, 7 days a week, and you can call them on 1800 858 858. It's free and it's confidential.
Fred, as always, thank you for generously sharing your personal experiences so openly with us. It's not easy to do so, and we really appreciate your reflections on the challenges that you've faced and the effect of your experiences on your family and your friends. Stories of recovery like yours offer hope to others in similar situations and are therefore truly inspiring. On a personal note, Fred, I'm just so delighted to see you thriving in your studies, in your career, and as you grow into a positive role model for the young people you work with. It's now time for our expert panel. The members of today's panel have witnessed and sought to overcome a range of challenges within the health sector to improve the experience for their patients and clients. We've heard how critical access to professional help was to Fred's recovery. Unfortunately though, not everyone gets immediate access to the professional that is right for them. This means it's vital for the allied health and primary health sectors to be equipped to recognise, refer and effectively support people experiencing gambling harm. My colleague Tony Clarkson, our Principal Clinical Advisor here at the Foundation, will lead and moderate the discussion.
Good morning, I'm Tony Clarkson, the Principal Clinical Advisor at the Victorian Responsible Gambling Foundation. Welcome to Gambling Harm Awareness Week. We're here with a panel of experts to talk about gambling harm, how people present with gambling issues, what co-occurring issues people present with, and how we can better screen for gambling issues in services. Hester, can I ask you to introduce yourself?
Yeah, so I'm Dr. Hester Wilson. I'm a GP and addiction medicine specialist working in Sydney, and I'm chair of the Specific Interest Group in Addiction in the Royal Australian College of General Practitioners.
Good morning, Gus CLELLAND, or Angus to be really formal. I'm the CEO of On The Line Australia, the organisation that delivers men's line and suicide callback service and Suicide Line Victoria, etc. Previously the CEO of Mental Health Victoria and the chair of the Head to Health Technical Advisory Group, and many years of working in the sector, including with Lifeline Australia.
Good morning, I'm Dr. Evan Simons. I'm a consultant psychiatrist. I work at Alfred Health in Melbourne. I'm the head of consultation liaison and emergency psychiatry at the Alfred, and I'm also the medical lead of our addiction stream. I've had a lot to do with the Alfred-based Gambling Minds program over the years.
I might start with you, Hester. I was interested in, from a general practice perspective, is it difficult to spot when people present with a co-occurring mental health issue and gambling issue? Is the gambling part difficult to spot?
Yeah, look, I think it's something that we as general practitioners, including myself, have not looked for. And I don't think it's something that is readily available. It's not like a rash on your face that, you know, on a patient's face that you can see. It's something that you do have to ask about. And I don't think it's something that we have really thought a lot about asking in the past.
So do you think GPs then often don't know where to look, or aren't aware of the question to ask? Or
I think one of the issues for us as general practitioners is that we're ideally based to deal with everything, and we're busy. And the other dynamic is that if you don't know what to do, what are you going to do if you get an answer? If you ask someone about gambling and they say yes, and then you don't know what to do, you don't really want to ask the question. The other thing is that it's got to fit within a general practice, general approach. And so the idea that you can ask a series of questions just to do with gambling as a screening tool is probably not going to fly in general practice. And my colleagues will say to me, I want one question. One question that will help me screen. And then just an easy kind of path to referral. Of course, some of my colleagues will want to do more in-depth work and have an interest in the area, but for most of us, we're busy, we're generalists. We want to be able to assist our patients with all of their health needs, and gambling is just one of them. So to contain it as a one question, know what to ask, know it's going to be effective, and then I've got the capacity to say, well, this is where you need to go, is going to make it so much easier for us to do this.
We've started trialling a screening question with allied health practitioners, and it was one of the reasons for that was exactly what you discussed. The idea that often people disclose a gambling issue to a physiotherapist or a chiropractor or even somebody not in any kind of clinical practice. Hester, is that something you've experienced in general practice? Is it something that people disclose to other members of your practice? So for example, a practice manager or a nurse, or people talk about addictions to anybody other than the therapist?
Yeah, look, it's certainly something that I've seen, and I think what's important about that is that our consumers or our patients' relationships with different members of our team is different. So there'll be lots of ad hoc kind of very kind of low threshold conversations with our administration staff, you know, and so they'll know the patients quite well. Our practice nurse who might be doing something else or giving a vaccination, and there's a chance to chat at that point. I had one patient that came in after he had a chat with his hairdresser. So it's those different touch points that people can have, and the accidental kind of opportunistic asking of those questions or screening of those questions. And certainly allied health staff, nurses, you know, reception staff, practice managers are all clinical staff, and do have this opportunity if something comes up once again to flag it and encourage the person to actually talk to us about the issues that they're facing.
So if we want to increase practitioners' awareness about gambling and increase the availability and uptake of support services, then it sounds like what you're saying is we kind of need to do that in different spaces at different levels. But in terms of education, what more do you think could be done in terms of getting this on people's agenda, either earlier in their career or when they start practicing?
Yeah, look, I think it's something that I know I haven't done well, even with my addiction specialty. That, you know, the first thing is really understanding there are significant harms. It is common. You know, it affects up to 7% of the community and their families as well, the impact that it has. And that's certainly one of the things that I've seen in my practice is family members coming in talking about the harm that has happened to their family as a result of the gambling of a partner. You know, but to give primary healthcare staff, including GPs, the information around the risks and the harms, and look, then encouraging them to ask that question. And for me, I'm always thinking about it in that general term, so part of a lifestyle screen. And certainly I don't want to downplay the seriousness of gambling issues, but to set it up as part of a general spiel that we do, you know, to say to our patients, as your general practitioner, as your practice nurse or whatever, I'm concerned about your health and well-being, and we know that things like smoking, alcohol, other drugs, stress, gambling can cause people issues. You know, have any of these been an issue with you? So I think sometimes people don't realise that it's a medical thing that we want to know. And also, of course, the shame and stigma and the secret, the hiding. But, you know, just flagging the concern, opening up that conversation allows people to then start thinking about whether they seek help. And I always see this, it's the same with any of the potentially addictive behaviours. You know, each of us have a role, and we're just one little peg in the kind of the clothesline of people's interactions with services that help them to move towards, maybe I need to do something about this, maybe I can seek help.
The one question screen that we've used or we're trying to promote for use in primary care and allied health professions is essentially, in the past 12 months, have you had an issue with gambling? Like Gus, maybe for your telephone counsellors and online counsellors, is that something that is useful? Is it too broad? Does it need to be more specific, or do you think it's short enough?
Look, I think it's probably in that Goldilocks zone of being just right. Clearly, there are situational factors there with clinician perhaps is dealing with sort of a crisis response, and they're not going to be asking those sort of questions. So it's up to the judgment of the clinician concerned. But something like that, I think, would be quite useful and quite easy to, if you like, slip into the standard operating procedure, if you like, or the way that this is done. I could see very a good application to Men's Line in particular, and you know, it's more of a general counselling service, obviously targeted at men, but lots of women do call it as well. With the straight suicide lines, like Suicide Line Victoria, it would be one of those situational factors, I guess, for the clinicians, but very straightforward, I think, in terms of adapting the service model. But what we'd be very keen to ensure is that part of a sort of a general response across the system, and getting back to that issue of, you know, standardising the approaches around intake and assessment and what have you across the state, Commonwealth and state-funded services. If we can get to that point where we're all doing this, then that would be highly beneficial, I think, and would really, you know, sort of crack into addressing this as a you know, as a harm and provide a better outcome for the help seeker concerned.
Evan, down at the I suppose the pointy end, that you would see, I suppose, more people at that end. How well prepared are psychiatrists to ask questions about gambling? And I know the Alfred's involved in a project at the moment with educating psychiatric registrars, but is addiction and gambling a part of the curriculum?
Well, traditionally, addiction generally hasn't got nearly the airspace that you might hope in training all the way through undergraduate medical student training, and certainly in postgraduate psychiatry training as well. I think that's gradually shifting, and we'd like to think that that our little program has made a contribution in that respect. But there's still a lot more that can be done, and I think, you know, generally speaking, we probably still haven't reached a point, even within mental health, where it's generally recognised that problem gambling harms, gambling disorder are core business for mental health specialists, to be honest.
And Gus, that idea of core business, I suppose on the lines, core business is mental health and well-being, suicide prevention, and we know that there are significant links between gambling and suicidal ideation and suicidal attempts. And working as a gambling counsellor, I've encountered a number of people who've expressed an intention to end their lives, and often that's a difficult thing for telephone staff, counsellors, but also any kind of help-seeking professionals to address. So how does just giving a screening question to staff in your area, how does that help?
Well, look, it opens up, I guess, a pathway for additional care, and that's the key issue, I guess, that we're all sort of grappling with. We've got services that operate to a large extent in silos, and they're not well integrated. And this is obviously a key feature of the Royal Commission and the Productivity Commission inquiry and countless other inquiries over the years. But if we know what some of the underlying issues are, we can appropriately direct people into the right care. But the key thing, though, is that we need to be able to do that in a way that really supports the individual, that the concept of a warm transfer, which is sort of almost the holy grail, if you like, of service provision. But if we could do that in the online, or sorry, the digital space, the telephone space, to the gambling helpline or equivalent, and keep people safe until they can go and see the GP, or it might be a community-based service, that would absolutely provide a huge benefit, I think, for the individuals. But critically, we've got to make sure that those support services for problem gambling are there and available, and 24/7. Really, it needs to be accessible to everyone in the state and nationally as well.
What do you think clinicians need to know? And I don't want to get too into the weeds, but I think it's important for people to understand what needs to be part of a referral for it to be effective.
Look, I think bottom line, for me, when I'm referring someone, it's thinking about what is appropriate for that person. And if I understand how a service works, so for example, if I'm going to say to a person, I really think it would be good for you to go and see this particular gambling service. I know so-and-so from the service, or I know this is how it works, this is what it costs, this is the wait time. And I know those things are difficult to always have up-to-date knowledge, but for me to be able to recommend it because I've got some positive experience of it, and it's not a faceless, nameless, just go and see that place down the road. That what I know is that for me, and I know it's for general practice in general, is that our patients trust us, and they do take our advice. And if I'm able to say to them, look, this is really important, this is a really great service, this is how you contact them to make the appointment, go for it and I'll check in with you. That's much more likely to be a successful referral than if it's just you need to go and see someone else, I can't help you.
So it's that idea that you talked about, Gus, that idea of a warm referral, but it needs more than just, here's somebody with a gambling issue, can you sort them out?
Here's a pamphlet. There certainly has to be, I guess, access and availability at a local level, and much of this is about individual choice as well, choice and control of the person seeking help. It may be that their preference is to seek help online through a telephone or a web chat type service. For others, it'll be face to face, in a local setting, or it might be in a group setting. But having all of those services available within the local community and providing individuals with choice is a big part of this as well. And the difficulty for GPs and others to know what's available is a key thing. We've got to make your life easy as much as we possibly can, and to sort of take a local, regional and a state level sort of approach to this, that would certainly help us, I think.
Can I ask then, I suppose, drilling down a little bit into the actual issue of people experiencing harm from gambling and complex mental health, what are some of the symptoms or what are some of the presentations? How would someone present who's experiencing those two issues, and how do they interact?
Yeah, sure. So it's very clear that mental illness can be both cause and effect with respect to gambling harms, and I think out in the community on any given day, health professionals could encounter people that are presenting either way, but certainly at our end, I guess at the pointy end, what we find generally is that people coming to see us are experiencing both. So typically they would be people who have vulnerabilities, for example, stemming from early life traumas. They may well have a genetic predisposition to addictive behaviours more broadly, and in the course of growing up in an environment that's affected by this predisposition to addiction, it's likely that it will have been very difficult for them to kind of establish, a healthy range of ways of dealing with life's stresses, and then they find themselves, access to gambling is pretty universal these days. It's a very easy kind of recreational behaviour to get involved with, and then in the course of, they tend to be those people who only need to attend a poker machine venue 2 or 3 times, and it starts to become harmful for them. And then the harms that flow from that impact extraordinarily substantially on their mental health. So the financial stress, the stress on their relationships, at the severe end, sometimes the exposure to kind of criminal elements, whether it's in generating the funds to continue gambling, or in attempting to repay debts and so on. And as I said earlier, just alone the burden of keeping secrets, the shame and the guilt that these people live with, is, these are all very potent drivers, particularly of depression and anxiety, and that's, that kind of cycle, if you like, is the most common presentation that we see in our service. But I think it's, coming at it from a different angle. We know from some work done in 2017 by Victorian Manning and colleagues that involved more than 800 people seeking treatment for mental health problems, severe mental health problems, through community mental health services, that group are at enormously increased risk of developing gambling problems as well. In terms of the most severe gambling harms that tend to attract a diagnosis of gambling disorder, people attending Victorian community mental health services are at 8 times the general population risk. And in terms of looking at all levels of gambling harm, from mild through severe, 1/5 of people currently being looked after by our community mental health services are experiencing some harms related to gambling, which is enormous. And again, this is part of why it's so important that our mental health clinicians are being, are learning about this issue.
Hester, I wanted to come to you about awareness. You touched a little bit earlier on levels of awareness of gambling issues, and we know that people with lived experience obviously are very aware of it because that's what they're presenting with. But in terms of GPs, is it something that people are aware of the severity of the issue or the prevalence of the issue, or is it too far down the list of other issues that people present with on a daily basis?
Yeah, look, that's a tricky one in general practice because there's so much that we need to deal with. I do think that it has been low on the list of priorities, and I think that there's some work recently happening in this space to just really help us as a profession to be aware of the prevalence, of the risk, of the harms, and the fact that, I think it's something like less than 10% of people will actually voluntarily raise that as an issue, and so we do need to screen. But as I said before, we're busy. And why would we ask the question if we don't know what to do next? And ideally for everyone there would be the capacity for a GP to say, to ask permission to ask about lifestyle issues, to ask those general questions about lifestyle, including gambling, to be able to ask, have you had any issues? To use the screening question, have you had any issues in the last 12 months? But what do you do then if the patient says yes? So there's got to be capacity for you as a GP to say you can go to this service, here's this online service, and to know that is available and that those services have capacity. The other thing that we've seen that is an aid for this is the adoption of health pathways, which we use in primary care, very clinically based online tool where you can go, oh, what's gambling? Put gambling in and out comes, what question to ask and where to send, which is brilliant for us in primary care.
So it sounds like there's a number of different options to introduce screening tools into the system. And with the, not just scarcity in terms of practitioners, but general scarcity in terms of funding and resources and how do you do all this? If we were just to pick sort of one area to focus on, training or upskilling clinicians or building content into curricula, what areas do you think should we focus on more?
I think for me it's understanding that gambling is one of the addictions or one of the harms that can happen through the choices perhaps that people start to make and then find that they get stuck in it. So making it very general, but as Evan said, addiction and mental health, they're a small part of the medical student experience, whether it be undergraduate or graduate, and any of us that have tried to push some of that into curriculum have been told, yep, look, we get it, it's important, but as is everything, and there's only so much time. But certainly in terms of postgraduate training for GPs, we had some recent funding through the College of GPs and through the College of Rural and Remote Medicine from the federal government to do drug and alcohol training, but that didn't include smoking and it didn't include behavioural addictions. So there was a bit of a missed opportunity there. But we have been doing some work in terms of exam questions and Check, which is a program that GPs do as part of this CPD, some articles, some training and webinars, and really I think once again the core in that is first of all what is your baseline that we all should be doing in the general practice setting is actually asking the screening question and knowing where to refer. But I think we do need to be really aware that we're not going to ask everyone. And so when are the times when clinically it's more appropriate to ask? So a kind of, rather than a universal screening, which sounds great but doesn't happen because we're super busy, that case finding. So if somebody presents with mental health issues, if they present with insomnia, if they present with relationship issues, if they present with financial issues, is gambling part of that? Thinking about how we can be really clear about these are the high risk times, and yes, it may happen at other times, but these are the high risk times that it's really worthwhile asking the question and knowing where to refer.
So there's quite a lot in that, but I think what I'm kind of taking out is that actually we can't afford not to ask, in particular because of not just the individual harms that people experience, families experience, communities experience, but more broadly. I mean, we conducted some research a few years ago that told us that in the Victorian community, the harms associated with gambling the social cost is around 7 billion a year. So we can't really afford not to ask the question, can we?
No, the simple answer is no. But the thing that comes to me out of that is we need to have awareness raising campaigns for our general community as well. And we, you know, there is so much gambling and advertising, you know, that is, you know, that my kids see. Because don't forget, we as GPs, we're part of the general community as well, and we will see those. And also it means that our patients, then their families, may well come in and say, look, I've seen the ad about gambling, I've realised this is an issue for me or for my family member.
So it's kind of goes back to what you were talking about, Gus, which is this idea that there needs to be a framework, there needs to be a system in place. We can approach it from a whole load of different angles, like community awareness, behaviour change campaigns, individual clinician training, but there needs to be something there to refer into, and I suppose that's kind of on commissioning bodies, it's on government and policymakers, but there's some upward pressure, I suppose, that even clinicians and service delivery can apply to that, and that's going to be a big part of any kind of change, isn't it?
Absolutely, and I think if we look at the mental health sector itself and all of the awareness raising and that, you know, encouraging people to seek help and what have you has been terrific over the last 20 years. There's been quite a change, you know, and a sort of reduction of stigma and all of those sort of things, and that's fantastic. But if we don't have a service system sitting behind it, what happens next? And of course, we have a huge problem with or referred to as the missing middle in mental health, with, you know, individuals who are perhaps their conditions are more complex than general practice can deal with, but they don't reach the very high threshold that, you know, the state mental health systems set because of the rationing issue of services, and that they sit in the middle. And you know, what do they do? We've got to make sure that the service system around problem gambling is appropriately resourced, and, you know, part of it is an advocacy piece, you know, from the sector and the broader sector, but there are a lot of allies out there.
Very briefly then, one last question for all of you. What does success look like in 5 or 10 years' time? What needs to have changed?
Well, really, the first bit is that at a public health level, there's been change that has actually reduced the overall prevalence of gambling harms. And then zooming into those that continue to experience harm from their gambling, that a higher proportion of them feel able to seek help one way or another, because we know at the moment the proportion is very low of people that ever actually put their hand up and say, I need to do something about this. And then that at the service level, which, you know, whether they've presented to general practice, to specialist mental health services, to addiction services, that they are satisfied by the response they get there and then. You know, ideally, we build capacity in all of those different settings, so that, of course, there will still be a need at times for people to be referred on, but generally we know that people who are distressed, who are suffering, would rather see one person or one service at least which they trust, and you know, get their needs met there.
And look, if we can get a measurable improvement, I guess that's the key thing. Too much government policy doesn't include the measures, doesn't include outcomes. So we need to set some targets and work towards those and resource the service system properly.
You need a trained workforce. And so certainly my experience has been with Medicare billing counsellors, brilliant with anxiety and depression, not so great with drugs and alcohol, and probably don't have the expertise in gambling. You know, and so building that workforce, building capacity, you know, having the capacity for GPs that are interested to do this deeper kind of counselling work, you know, making sure that the services that are available, it's clear what they can offer. Can they offer care for carers or family members? Can they offer financial you know, support or, you know, counselling, or if not, where do people go for that? You know, making sure that the services that people need are available and the staff are well trained.
Great, thank you. Thanks everybody, it's been a pleasure chatting with you.
Thank you, Tony, and thank you, Hester and Gus and Evan, for that thoughtful discussion. It's really clear a lot more needs to be done to better integrate the services available to people who experience gambling harm and co-occurring issues, as well as to improve the pathways to those services. This is a complex and challenging issue, but it's encouraging that something as simple as a one-question screening tool may be the start of a life-changing journey for those who are asked that question. Well, I really hope you've enjoyed today's event as much as I have. Gambling Harm Awareness Week officially concludes this coming Sunday, but I hope you've all been inspired to continue the important work we all engage in to address gambling harm and to improve the health and well-being of all Victorians. Thanks very much and enjoy your day.